the bulk of this is more eyes and ears. That's where the heavy stuff is. Nose and taste is really simple. Right?
What did you say the bulk of it was? The
Eyes and ears.
okay.
Okay, so look and listen. How's that?
Yeah.
See.
All right.
Touche.
Okay, so most of the sensory receptors, so most of what you have in your eye is sensory, right? Because that is how you see. And the thing that allows you to see is called the retina, right? Which then connects back to the optic nerve and then goes to your visual cortex in the back of your head. It stops along the way at a couple places to generate some memories. But in terms of the actual vision piece of it, you're seeing with that visual cortex. You're going to have some hairs, eyebrows and eyelashes. Those are the things that help protect your eye. And then your eyelids also help protect the eye, but they also have that blinking reflex. Okay? Blinking is a reflex that helps coat your eye with the tears. Right? You're not always crying all day long, but you've got a lacrimal apparatus there that helps put the tears on there and keep it moist. The conjunctiva, that is a membrane. Okay, it's very important. So when this membrane gets inflamed, it's called conjunctivitis.
Pink eye.
And you guys call it pink eye. All right, it's a very, very contagious thing. If you would like to pick one up, you can go to Target or to Walmart or the grocery store or the gym or any of those places and touch everything and then rub your eye. Right?
Or go run through.
If you can't pick it up
Go to the
there,
daycare.
just go to a daycare, go to McDonald's, play in the little playpen. Probably think you're weird if you do that, but anyway, that is where you pick up pink eye.
Or go run through a cornfield. What, that's
Yeah, pink eye.
Conjunctivitis.
Okay, conjunctivitis will irritate that
The
membrane.
conjunctiva is just the
It's just inflammation of that membrane,
yeah.
right? But it's very contagious. So the lacrimal apparatus is located up in the eye. This is the thing that then puts this dilute saline type solution and covers the eye and keeps it moist. It also has this thing called a lysozyme. Okay, lysozymes are antibacterial things that your body makes, right? And it helps prevent certain bacteria from getting in. Obviously, not everything. And if you guys remember, your little lacrimal bone had at the base of it a little hole that was called the lacrimal duct, and then that one drains down into the nasal cavity. So that is how the excess fluid comes down. All right, so here's your eye, and then here are your eyelashes, and then obviously the eyebrows up top. So what you guys are seeing here, the thing that I don't understand is when you put a bunch of mascara,
That's
fake
long
eyelashes, all of this extra stuff on here, okay, all you're doing is irritating this area right here. If you irritate that enough, then it's just going to progress the inflammation internally. All right, can cause more problems. So you got to be really careful with what you do, you know, all around the eye. All right, so it's really, it can be really dangerous. The whites of your eyes are your scleras, in case you guys are wondering. And then this is your iris, okay, pigmented region, and then this region here is going to be your pupil. We'll talk about that in a second. When you look at the eye laterally, you can see where the cornea is going to be the outer fibrous membrane also that helps protect the eye. We'll get more into details with this stuff in a second. Okay, so that's where your lacrimal apparatus is located, is up here on the upper right corner or lateral corner, and then it comes down and then drains into the medial region and then comes down into the nasal cavity. So that is how it helps keep the eyes moist. If you wear contact lenses, it's better not to keep them in all the time, right? Your eyes do need to breathe, and it's easy also to get stuff stuck in that contact lens, and then that'll cause an irritation or it can cause an infection. So
Why
you
is
gotta
it
be really careful with that.
when you cry your nose runs? Because of that right
the
there?
stuff coming down into here. So you're just producing excess.
Okay.
Here's a criminal.
All right, so you have 6 muscles that move your eyeball. All right, these are skeletal muscles. So what they do is they allow you to look up, look down, look side to side, and then of course roll the eyes. So these are the muscles and what they do. You've got the lateral and medial rectus muscle, and that one moves the eye laterally and medially. All right, so that was pretty simple. Then you have superior rectus and inferior rectus. One moves up, the other one moves it down. So it allows you to elevate and then depress the eye. The rectus muscles are superior and inferior. These allow it to go up and then medial. And then when you look at the superior and inferior oblique, these are the ones that allow it to turn and then look laterally. So when you're looking down and out of the corner of your eye, you're using the superior oblique as well as the medial rectus. So, and then the nerves that you guys learned yesterday, the abducens, oculomotor, and the trochlear, those are the nerves that then innervate these specific muscles. So the one that allows you to move your eye laterally was the abducens, and it innervates the lateral rectus. Then your trochlear, this is the one that innervates the superior oblique, and then allows you to look down and then go laterally. So it's pretty cool how all these things work together. And then these muscles actually insert directly into the eyeball, right? Your eyeball's not just this mushy, gooby thing. It's actually got the fibrous tissue that surrounds it. So this is where these are located. Now you're looking at it from the lateral view. So this guy here, oops, okay, this is your lateral rectus. This is the inferior oblique. Your superior oblique is going to be up here. Then right there is your superior rectus. And then there's your medial rectus right there. So the eyeball is really well protected in here. And it's very hard to get your eyeball hanging out of your socket. All right, it has to be a pretty traumatic accident in order for that to do that. So that's why they sit deep inside the orbit. It's protected by the bones of the face. And then posteriorly, what you guys see here, this is that optic nerve that then innervates right in the back of the eye. Tomorrow when we do the brain dissection, you'll actually see where that optic nerve enters the posterior portion of the eye. And some of the brains may have eyes with them, I don't know. We'll see.
Cool.
So these are your layers of your eyes. You've got fibrous, which is connective tissue. The vascular is going to be how it gets its blood supply. And then sensory is where you receive the information. So this is where all your sensory receptors are located. This is primarily your retina, right? You also have pain receptors in the eye because the eyes are very sensitive. And you don't want to be doing stuff to them that are going to injure them. And then the fluid is called a humor, H-U-M-O-R. So those fluids are really important because they help provide the eyeball its structural integrity. If we were to dissect an eyeball and you cut it wrong, you will see it kind of just turn into nothing but cream of wheat, right? It's pretty mushy and gross. And then your lens is what separates your eye from the anterior to posterior cavities. So when you look at the eye laterally again, right, this right here is your lens, and then this part here is the anterior, and all of the stuff back here is the posterior. What you see here in the red, all of this is the retina. The yellow is all optic nerve, and then internally you're going to have the fluids and then the vascular region of the eye. And then this little area here, these are little muscles, they're called ciliary muscles, and what they do is they then connect to the lens through these little ligaments. And these are the muscles that allow for your lens to focus. These are very important because they allow you to see close and they allow you to see far. As you get older, those are the ones that tend to get lazy, right? The ciliaries, these guys right here. And then up here, okay, you're going to have other circular muscles that then surround the iris, and then what they do is they allow for the dilation and constriction of the pupil. So it's very well innervated, and the eye's a pretty complicated structure, which is why I always say why the ophthalmologists get paid so much money. And you know the difference between ophthalmologist and optometrist, right?
No.
Yeah, the ophthalmologist is the person that's the MD that would actually go in and treat, you know, an issue with the muscle or something with your retina, or the cataracts, LASIK surgery, okay? The optometrist is the one you go see at Costco that fits you for your glasses. And they can do some other stuff too, but not the same things that the ophthalmologist does. No. If they say you can do surgery, you should probably leave, right?
Right there,
So,
Costco.
yeah. Your fibrous layer, okay. The sclera, these are the whites of your eyes. And your scleras say a lot about what your health is like. So when your scleras are yellow, that is one of the ways that we know that something's going on with your liver. Okay, that's a really indicative case of jaundice. You'd also notice that the skin is pretty yellow. But the sclera is what helps protect and then shape the eyeball. So it helps provide its structural integrity. And then of course it anchors the muscles that are located on it. Your cornea, that's going to be the transparent anterior portion. It's another fibrous layer. And the really important thing about the cornea is that it does this. It bends the light as it's coming in. And that bending of the light is called refraction. Yeah.
When some people get really hungover or have like a crazy day, because my
dry and then they get irritated.
Alcohol.
Mhm. Yeah, because what alcohol does is it dehydrates you. And so one of the places you're gonna get dehydrated and it's gonna be in your eyes, because your eyes are very moisture. Okay, so that's part of, that's the other thing the cops look for, what color are your eyes? Alright, so the cornea, you guys, is what bends the light as it's coming in, and you need the light to bend in order for you to be able to see the image, and I'll show you how that works in a second. And then you also have little sodium pumps that help maintain the clarity of it, and this is where you have a lot of these pain receptors. So when you scratch your cornea, you know you did it. Okay, it can be very painful. This is why it's important if you get something in your eye, don't just reach up there and, you know, itch the heck out of it, or if you get a bug in there, because you don't know if there's something else. So just close your eye and it'll hurt for a little bit, but the tears are gonna help wash it away. And then they'll go get taken care of, and you have lymph stuff in there that cleans it up as well. So, but you need to have, your corneas are really important. You can actually get these transplanted from cadavers. Kinda cool.
Oh, wow.
I'm gonna have to have a cornea transplant.
Are you?
Do you have keratoconus?
Oh, yeah. The vascular layer is called the uvea, UVEA, all right, and that's where the blood supply is located. You have three regions. It's called the choroid, the ciliary body, and then, of course, your iris. And the choroid region is going to be the upper portion, and this is what supplies blood to all the layers of your eye. Okay, so what's important about this is that your eye needs to have a blood supply. If the blood supply gets cut off, the eye is eventually going to die because it's so heavily dependent upon those neurons for you to be able to see and do what you got to do. So this uvea region is very, very important, okay? And then you have brown pigment that's located within the iris region that then helps absorb some of that light to avoid, you know, the confusion of having too many, you know, bright lights coming at you. When you can't see something is because you basically almost shocked your eye. All right, your eye hasn't been able to adjust when that big flash of light comes in. So you need to. Man, that was really interesting today. All right, the iris, that's the color of your eyes. If you don't like them, you can go get contacts to change them,
Oh, okay.
right? You can get vampire contacts, you can get all kinds of contacts.
Vampire.
So
White.
the iris is that color
Vampire.
part, right?
So crazy.
This is one you definitely blame the parents on. The pupil is the thing that regulates the amount of light that's coming in and out. And that one internally is surrounded by a circular muscle that then dilates and constricts depending on what you're needing to do. All right, and then also your emotional state obviously is going to be dependent there. So here's your parasympathetic over on the left, and then here is your sympathetic. So when your sympathetic system really ramps up and you get that huge epinephrine dump from the adrenal gland, this is what you're going to see. Okay?
So how come when your pupils dilate, I mean, wouldn't that, 'cause it's supposed to increase your field of vision, right? So you can see better, clearer, or
Yeah.
sympathetic response, but the more your pupils dilate, the more light that comes in, so wouldn't that,
It's so you can see better as to where you're going. But then what also happens is your lens focuses better,
oh, okay.
so you can see where that's coming in.
Okay.
It's almost like the flashlight goes on, is how I always think of it. Okay, but yeah, you need, this is what you want when you're having a sympathetic response. Okay, you have a question?
What's the thing, like when you're outside though, you know how it closes, so it doesn't get damaged?
Yeah, so you're gonna have more constriction so that you don't have as much light coming in.
It's gonna open, but then it's gonna, of course, sports outside.
Yeah.
So, I mean, does it like regulate that, like don't open too much?
Yeah, it'll regulate based on what the receptors are telling it in terms of how much light is coming in. And then there's very specific receptors you'll see in a second that have to do with which ones are letting the light come in. Because some of them are going to depolarize, otherwise they're going to be inhibited. It just depends on which ones are turning on and off. All right, so your retina, this is my favorite part of the eye. And the retina has got a couple layers on it. You've got a pigmented region and then an outer region. And then its whole job is just to absorb the light, prevent it from scattering. So when you have something going on with your retinas, right? Your blood pressure suddenly spikes and your retina detaches, or so you have some kind of trauma that causes it to detach, right? You're going to see light that's going to look kind of scattered, all right? It could almost look like pixels, or it'll look like you've got little dots or like little blank, like